Because there's not enough spirit in them, they put outside spirits. I'm so loaded with spirit, I didn't need any outside infusion. Anybody who comes, do you put blood infusion into them? Only when they have lost. When they've lost blood, you do blood infusion, isn't it? So only when you have lost your spirit, you do spirit infusion. I'm fully drunk all the time. So it never occurred to me that I have to infuse something from outside. So, it doesn't matter. They need a break for some purpose, that is perfectly fine. But it's very important that you don't make this distinction, what is work and what is life. If what you're doing is not your life, please don't do it. What you're doing is life, isn't it? You're fixing somebody's bone, it must be your life. It is your life, isn't it? You spend more time with broken bones than with your family, yes or no? So, which is life? Why this is not life and that is life? This is also life, this is one dimension of life, that's another dimension of life. How to distribute time? The requirement may be different from different people. For an individual person, he may need that much break, another person needs less break. Well, every weekend if you are at home, maybe your family enjoys it. In another family, every weekend if you're home, maybe they don't want you there. We don't know what's the situation, I'm saying it varies from person to person, from situation to situation. So, it's very important that we understand that from the moment we are born till we fall dead, we are doing only life, life and life alone, nothing else but life.
So one last question before… you'll be knowing that there is a lot of doctor bashing in the media. So there is…
Oh, you also… I thought there's a lot of guru bashing happening.
No, it's against the whole community.
You're just telling the wrong guy.
So, I mean, it's natural for the doctors in training to feel that they are spending huge hours, long hours, they are working hard. Maybe a perception, but definitely most of the doctors in training work harder. They give much more than this, but they are not earning the respect any more than what kept the doctors of the previous generation going. In this demanding… I mean, there is a discrepancy of expectation, an expectation gap, both from the doctors to the society and society to the doctor. How do you keep the passion going in these trying circumstances?
See, there are many aspects to this. Let's first of all look at the times in which we exist. In this culture, we always insisted education, health and spiritual process should never be commercialized. This has always been the norm. But we said this when these things used to be sponsored by a king or somebody. He sponsored the education, he sponsored the hospitals, he sponsored spiritual process. So, no charge for the people because it was sponsored by somebody. Those sponsors have disappeared in democratic societies. So everybody has to handle their own economics. And whether it comes from your pocket or my pocket, somebody is spending for every activity that happens in the world. So that goes for medicine too, particularly because of technology and of course, there are many gray areas. Technology costs. Diagnostics is costing more than the treatment today. But because of this, many things are being caught in time. Otherwise, most people will die without a diagnosis. People are always thinking there is more cancer today, definitely there may be, most probably. But I think it's also a question of diagnostics. It's also a question of people living longer. When people died early, of course they died healthy. Oh, now when people are moving into 80s and 90s, of course they're having various issues. So, one aspect that's happened is medicine or health has become an expensive process. Modern medicine is a culprit in this, big time, because we have taken a complete turn towards it. We should have gone towards it selectively. Where it is necessary, yes. Selectively means there is one norm we could have employed. I'm not saying this is a perfect norm, but we could have. There is, as you know, there are infectious diseases and chronic ailments. How we see this in the yogic way of seeing it is, infections are an invasion from outside. You have to wage a war against them. For that you need a doctor and medicine. Chronic ailments are something that we manufacture from within. For this, you need awareness, you need yoga, you need observation of what's happening in your system, of your lifestyle, how you sit, how you stand, how you breathe, everything you need to observe. If this distinction was made and we enforced it in every society, then medicine would not have been so expensive. In many ways, with vaccinations and various other things that we have done, largely infectious diseases are very small, isn't it? Today, most of the ailments are chronic, isn't it so? Self-made in a way. Chronic means it's coming from within us. When every cell in this body is geared and, programmed for health, why is it ill health happening? Obviously, we are doing something fundamentally wrong with life. In the yogic system, we are looking at it like this: if you keep this body in total ease, almost every chronic ailment that you have, it will handle by itself if you give that much space to it. Otherwise, if it is not in ease, how is it? It is in dis-ease, so it's a disease. But now, we are treating everything… we think… When I said this about psychological ailments, because you talked about media, the Bangalore media has been after me for last 1.5 years because I just said this: you are fundamentally responsible for your psychological well-being. Just this one sentence. They've been campaigning against me for last 1.5 years. So recently when I went, again it came up in some kind of a conversation. So I said, see, you were saying something more dramatic, but for example, millions of people have died of cardiac problems. Millions and millions have gone through cardiac surgeries. But today, doctors are busy telling everybody, if you don't eat red meat, if you exercise every day, if you do this, this and this, most probably you will not come to my surgery table. And it is so. Millions have not gone there simply because they're maintaining a responsible way of living in some way. So, their argument is that psychological ailments or medical problems, you cannot solve it by your responsibility. I'm saying if you behave irresponsibly, every one of you can go crazy right now. Yes or no? Every one of you can get sick within the next few days if you behave irresponsibly, yes or no? Is it possible or no? So, this should have happened. When modern medicine developed, we got little too overexcited about it. And we thought a doctor is a solution for everything. No, health is your fundamental responsibility. When it crosses a line, you seek some professional help. But daily health must be your business. Keeping yourself healthy must be 100% your business. Suppose you contract something else happened, either because of genetic reasons or congenital reasons or infections, something came, then the doctor should step in. But right now, doctor is there in your life from your childhood till you die. You will not be healthy, you will just be a patient. This is not a good way to go. So I think this distinction has to come. It is beginning to happen slowly. Doctors are looking at more holistic way of treating, but it's still a small movement. I think it should become a much larger movement.